My poster is titled Audentes, the Immediate Definitive Implant Bridge. The Odentis Protocol is about transitioning a patient from their current dilapidated dentition to a customized definitive implant-supported prosthesis in a single visit. It leverages digital technology to provide the most seamless and convenient treatment method for the patient and clinician. There are no impressions after implant placement and no cementing of components at surgery to compensate for any guide inaccuracy. It is simply the placement of a pre-made, bespoke, definitive implant prosthesis directly onto the implants at the surgical visit. The surgical visit is usually between 90 to 120 minutes long, with the patient being free to go home and does not have to return for 2 weeks for the first review. To accomplish this, an extreme level of accuracy is required, not just for implant placement, but also bone reduction and positioning the prosthesis within the patient's oral cavity. This accuracy is possible with the proprietary AuDentes workflow and Straumann implants. The patient in this poster was a 56-year-old male who presented to my specialist prosthodontic clinic requesting the removal of the remaining teeth and replacement of them with an implant-supported prosthesis. Previous medical treatment of interest included maxillofacial surgery for the management of maxillary and mandibular fractures due to a motor vehicle accident 3 years prior. Since the surgical reconstruction, minimal dental treatment had been sought. The maxillary dentition was deemed to be beyond reasonable repair, but the mandibular dentition was restorable. Various treatment options were discussed, and the patient gave consent to an immediate implant-supported bridge in the maxilla and a tooth-to-implant-supported bridge in the mandible. Patient care began with treatment of the periodontal disease and oral hygiene instruction. Once periodontal health was accomplished, the definitive upper tooth position was trialed, and patients' feedback sought using a virtual smile design software. This showed the need for adjustment of the mandibular teeth to achieve an appropriate occlusal scheme. Once the restorative design had been finalized, the implant locations were planned in conjunction with an oral and maxillofacial surgeon. Following approval by both clinicians and the patient, the data was sent to Odentis Implant Bridge for processing. This involved the design and construction of 3D printed surgical guides and the definitive prosthesis. The definitive prosthesis consisted of milled acrylic teeth bonded to a milled titanium bar using injection denture-based material. The surgical process was undertaken in hospital with the general anesthetic administered. The remaining upper teeth were removed, the maxillary bone recontoured, and a total of 6 regular neck standard plus implants placed with the aid of the surgical guides. The definitive prosthesis was also placed onto the implants and abutment screws torqued to 35 Newton centimeters as per manufacturer's instructions. The soft tissue was then sutured around the prosthesis to achieve primary closure. Antibiotics, analgesics, and anti-inflammatory medications appropriate to the patient's medical state were prescribed. The patient was reviewed 2 weeks after surgery to check on the soft tissue healing and obtain an OPG radiograph. The occlusion was also adjusted with changes to several lower teeth and a small section of the upper fixed prosthesis. The patient was then reviewed again at 4 months after surgery to remove the prosthesis for cleaning, to check implant integration, and collect data to measure the treatment outcome. The patient expressed an extremely high level of satisfaction with the aesthetic and functional outcome. All 6 implants were fully integrated and the soft tissue was in an extremely healthy state. The first patient treated using this protocol occurred on the 19th of April 2018. She had 7 extractions in a maxilla, 4 implants placed, and a definitive bridge as well in the space of 90 minutes. At the time of this recording, a total of 84 patients have been treated. They have had 90 bridges placed, 58 in the maxilla, 32 in the mandible. 18 of the patients were cigarette smokers. A total of 590 teeth have been removed. 6 of the patients were already fully edentulous and hence had no extractions. 370 implants have been placed with an osseointegration rate of 95.6%. All patients have received their bridge at time of surgery. 4 of the bridges have been remade for a variety of reasons. The treatment has been carried out by 4 different prosthodontists, 3 different periodontists, 6 oral and maxillofacial surgeons, and 2 general dentists. I would like to acknowledge the support of Mr. Tim Probert, the oral and maxillofacial surgeon who did the surgery for this patient shown in the poster. Also Mr. Lachlan Thompson, owner of Omni Dental Lab, for the fabrication of the prosthesis. And finally Dr. Neil Tuttle from Griffith University for helping with manuscript revisions. Thank you for your attention, and I hope you have a good rest of your time at the ITI Online World Symposium.